Hi, everyone. My name is Sumanth Swaminathan, and I'm the co-founder and CEO of Vironix Health. And for those of you who haven't joined us in the past, Vironix is an organization of scientists, machine learning experts, and physicians that maintains a primary focus on leveraging advanced machine learning and digital technologies to tackle the increasingly worrisome COVID-19 pandemic. We've developed a great piece of software called CovidX. It's a tool for getting global employers, schools, and institutions back to normal, mostly by conducting private and targeted symptom monitoring that leverages machine learning to detect infection and health flare-ups at home. Our hope, of course, is ultimately to mitigate both the immediate and long-term consequences of the novel coronavirus and a variety of other viral and chronic illnesses. As we go to market, we'll be bringing you regular updates on all social media platforms, as well as YouTube videos like the one that you're seeing now. And without further ado, I want to use today's meeting to discuss and introduce Dr. Nicholas Wysham. Dr. Wysham is a board-certified pulmonologist, MD from University of Washington, internship and residency in internal medicine from Oregon. Dr. Wysham is from the Oregon
Health Sciences University.
And of course, he's a fellow was a fellow in pulmonary and critical care medicine at Duke University. He's been practicing medicine as a physician and partner at the Vancouver Clinic for about 4 years, and he's also a clinical professor of medicine at Washington State University. He has provided critical expertise, experience, and validation during the development and launch of CovidX. And so, Dr. Wysham, of course, I've given down your resume, or read down your resume now, but maybe you'd like to introduce yourself to everyone.
Sure. I come to this collaboration and project stemming from my interest in fellowship. And what I came to realize then was that there's a tremendous amount of value to data that patients can supply. And so the traditional way that we practice medicine is still a bit paternalistic, you might say, and we don't directly incorporate the patient's voice. And so that led me to meet Sumanth at a research symposium where we were both presenting projects that hit on this around chronic disease self-management. So he and I have been collaborating for the last nearly 5 years around developing tools and software for COPD and asthma self-management. But when the novel coronavirus hit, we saw an opportunity to leverage some of those experiences and techniques to help address the pandemic.
Great. And welcome, Dr. Wysham, of course. And it's been a pleasure to work with you for several years, by the way. And to fill in that too, we've published quite a bit together. I think you're a remarkable talent and a fantastic contributor to the digital health space that we've been developing over the last 5-6 years. One of the big reasons we wanted to hear from you today is to discuss, really from your experience and from your professional background, why technologies like CovidX are so important right now. So what's the eminent need for these technologies? Because you've seen COVID-19 patients, so you've been knee deep in this pandemic. And so what do you think is really the near term, right now, eminent need for technologies like we've built?
Yeah, COVID-19 is a really unique virus, as I'm sure many of you know. It's highly transmissible, has great public health importance, and has such a range of symptoms. It's completely novel. So whereas we thought it is a respiratory virus, we now know that it's as much a vascular virus as it is that affects your lungs. And so in this, there's been a rapid process of learning, who may have the disease, who needs to be tested. And at the same time, our testing capacity, unfortunately, continues to remain constrained. So short of a tremendous investment in infrastructure and supplies to develop widespread, routine, and repeated population testing, you can imagine what kind of effort that would involve. We do need some tools to help patients, providers, employers, and other institutions better understand who may or may not have COVID-19, and help direct testing and other recommendations to help mitigate its spread while allowing the rest of the folks who remain healthy to conduct their lives as normally as possible.
Makes perfect sense. And so you touched on sort of diagnosing or finding the virus, of course, and then there's a big piece, I suppose, to the conflict, or at least in the prevention effort, to sort of at-home care and management, right? And can you speak a little bit to how this could improve? So why would a patient use this at home? How can this help a patient or an employee or a student in a school who might be asked to use the software at home?
Well, there's a couple pieces to that. There are so many different symptoms that are attributable to COVID-19. But if you look at any list, it's quite likely that you might feel fatigue on a given day or have a headache. And so these lists that are published by the CDC and others are of course very well intentioned and the best evidence we have, but because it's just a list decoupled from other vital signs and other intelligence, it really makes the patient or the layperson have to interpret their symptoms. And I can tell you from personal experience, even doctors aren't really equipped to do that in a novel disease. Additionally, there's such a wide range of presentations and courses in this illness. Many people I'm seeing now were diagnosed on the basis of an exposure or some mild symptoms a week ago or more, and then end up hospitalized and severely ill, 7 to 10 days into their course of illness. And that's a very unique feature of this virus. We've heard reports of people, suffering very severe consequences and even dying at home. And one of the hypothesized mechanisms of that, or reasons for that, is that the oxygen level can fall pretty dramatically in this virus without there ever being very significant symptoms. So one of the tools in CovidX is a home self-monitoring module or application that can help folks who are diagnosed with COVID-19 know when to seek higher levels of care. And so we can hopefully get treatment started sooner. The few treatments that we do have, we have every reason to believe, based on kind of hypothesized mechanism as well as the research coming out, that the sooner you get them started, the better. But that said, they're still only administered in the hospital setting. So if we know that someone needs to be hospitalized when they need to be hospitalized, we have every reason to believe that that would give them a better outcome.
Yep, makes perfect sense. And to sort of wind up that discussion, if you look at the ways we're trying to tackle preventative care right now, remotely, in terms of technology or in terms of existing practices and institutions, can you talk sort of about why or how this particular approach, maybe is an improvement over existing standards of care?
Right. So I think one unique feature of CovidX is that it does leverage machine learning and artificial intelligence. So it's derived based on both the guidelines that we know about this virus, but also deep clinical data sets that emerge around this virus. Coupling that with the artificial intelligence that learns a user's baseline health. And so again, contrast kind of a multimodality approach to a rules-based approach. A doctor might say, well, if your oxygen falls below 90%, please call your doctor. Well, I know that mine is always north of 97%, usually 98, 99, and that would be expected for someone who's healthy without any other, lung disease or cardiac disease. And what CovidX can do and will do, if I ever start to have my oxygen saturation fall, it will understand that 94% is a significant deviation from my baseline, and that will flag my vital signs, particularly if it's in conjunction with other reported symptoms, no matter how mild they might be. So this artificial intelligence approach to this problem, particularly when there are a lot of moving pieces, lots of different data inputs, can really help patients and providers, institutions make better sense of their employees' health. And again, gets back to directing testing, directing stay-at-home recommendations, directing when a patient ought to seek higher levels of care, present to the emergency room, et cetera.
Makes perfect sense. Well, look, Dr. Wysham, thank you for that, for your expertise.
Sure.
Okay, that very detailed response. We appreciate the experience and work that you brought to this, and we look forward to talking to you more about this tool as it progresses in the marketplace.
You're welcome.